let's start off with the introductions. Ax, why don't you go first, Brendo, and then I'll go last, and we'll open up the floor for questions after that.
Yeah, that sounds good. Hey everyone, I'm Brandon. I'm from Long Island, New York. I go to Stony Brook for dental school. I'm a D1 currently. And let's see what else about me. I went to Cornell University for undergrad, majored in biology and society, and then did minors in nutrition and business. So I tried to integrate everything all into one. My research in undergrad had to do with taste buds. So I definitely tried to strategically kind of orient everything so that I was like, I guess, best prepared for dental school, especially the business aspect, which is something I'm really passionate about. And so, yeah, like I said, I'm a first year at Stony Brook. We're, I think, 7 weeks in now. So it's definitely going. It's fast paced. It's exciting though, because it's finally things that I'm, really interested in learning about. And I guess more things will be revealed about me as we go through, but I think I'll pass it over to Sean.
Yeah, what's up, guys? I'm Sean, first year ortho resident at Stony Brook, graduated last year from dental school with Brendan, one of the co-founders of Top Professionals, Students of Dentistry, Top Dental Practices, Elite Dentist. Just went through the whole interview process, residency, and, the decision-making for that, the strategy of all those things. Ax just went through the applications for dental school. Brendan just went through he'll explain his applications and acceptance into OS. So we're here for you guys to answer your questions. I hope you guys can see we're very laid back. So anything that comes up, please feel free to shout it out.
Yeah, guys, we're here for you. The application process is a very stressful process, as we all know. Luckily, there are people out there that are there to mentor and help you along the process. The DAT is a monster. Getting into oral surgery, the CBSE is the monster. So everything's one step into the next. You guys will be fine. There's plenty of stuff out there for you to prepare for all these things. You should not have to pay for it. You should not have to pay for anyone to give you their advice. This is all things that we do for you. There's plenty of people out there that will do it for you. Don't fall for anything. I think the biggest thing for you guys as undergrads is number one, I would say enjoy it by far. Enjoy every moment that you have there at that level. God, I wish I could go back. Guys, what do you think?
Dude, you're not kidding, man. The free time, I know right now it might not seem like you have free time, but you have a lot more free time than you think. Guys, enjoy every second of it. It gets better, but your time just disappears faster than you think. It flies.
Then you get into dental school and the time goes away, and then you feel like you're just running in circles with studying the same thing over and over. But and Ax will tell you that, but it's all for a purpose. We got to make sure that you guys know that. Let's open it up. Let's open up to Q&As. I hope we could address everyone's question tonight. Let's really get to it since we're 10 minutes in.
Hi, how are you? I have a question.
Please.
Yeah, so I'm a high school senior right now, but I'm also interested into becoming a dentist. And I was planning to go to Queens College as my undergrad and more of a psych or bio major, and then go on to NYU or Stony Brook. Like, what's the best path for me that I could to stay on track or something? Yeah.
Stan, what do you say we do this in what do they call it? The snake order or the zigzag, where someone starts and then we go 3 and then that person that we ended on start with and we go back. What do you guys think? Let's do it. Okay, I'll start with that. Queens College is fine. It doesn't matter where you go in undergrad. Get into a school that you're going to feel comfortable with. Okay, make sure that they have all the requirements, the curriculum requirements, such as what is it? Bio, organic chemistry, general chemistry, math, a certain level of math. Make sure you're learning how to read. Reading comprehension is on the DAT, so it would be wise to maybe take a course or two to kind of introduce you to that. Other than that, everything else on the DAT, such as the PAT section, it's the spatial arrangement one. That's you're not going to learn that in undergrad. You shouldn't have to. The chem man guy does that stuff. He's fantastic. What do you guys think?
Yeah, I agree with everything you said. Actually, it's funny. My housemate that I live with, Stony Brook, went to Queens College for undergrad, and then he's here at Stony Brook. So that trajectory is definitely possible. in terms of like things you should do, kind of, I would recommend just doing things that you really enjoy, because you could really major in anything, and you don't have to go to an undergrad that has a dental school affiliated with the school, for example. So going to Stony Brook for undergrad is not going to necessarily give you a competitive advantage to get into the dental school. So keep that in mind. But like I said, do things that you enjoy. You can major in anything as long as you get those prereqs done. And then what I would think is, as you're going, just kind of ramp up the shadowing slowly, ramp up the research if that's something you're interested in. You'll kind of learn what you need to do to get into dental school. So it's basically like research, volunteering, taking the courses, generally doing well. There's a bunch of other things. But for that first year in college, not too much stress. Just try to knock out those prereqs that you have to do in the beginning. Yeah.
Yeah, I really don't think there's like a certain thing that's like the path to get into dental school. When you ask like what's best for me, only you know what's best for you. You know, if going straight to dental school is what you think is best for you, and going from undergrad straight through, then by all means go for it. If you feel like you need some time to make that decision before going to school, maybe you're not so sure about it, you want to get exposed to the field, you want to make a little bit more money before you go to dental school. Dental school is very expensive. You know, all those things are things to consider. We had classmates that were 30. There are people in the dental school that are, you know, over the age of 35, 40. And then there were some that are just fresh out of undergrad. So, you know, it's definitely up to you. I think if you're interested in dentistry, I think it's very underrated shadowing, getting exposed to the field, because I think we all get such a narrow field of, you know, narrow vision of studying for school and studying for exams. And I want to get into dental, so I want to get into undergrad, but you forget what the actual field is like. You're just so focused on school, you forget what your day-to-day life is going to be and if you actually enjoy it. So if you have the time, highly recommend shadowing and going and seeing what it's actually out there. Go and see the specialties, go and see what the profession of dentistry is and how it's changing, because where you are now, you're a high school senior. By the time you get to, you know, dental school, that's, you know, and you graduate dental school, that's 8 years away. And then, you know, if you do a residency, it's a minimum in New York of 9 years. Dentistry is going to be very different today than it was in 9 years, just like it is different now from 9 years ago. So definitely get out there and see what's going on. There's no path that is the best path. It's just the path that works for you. If it has to snake a little bit to get there, then it does. But, you know, stay on top of school. If you have your priorities right, you'll get there, no problem.
And Robert, just to, and Sean, to pick it up from there, Robert, a really good point to make is that you don't need straight A's in college. You don't need 100% A's to get into dental school. You don't need 100% A's to get into oral surgery, orthodontics. What you need to do is be the best applicant you could be, okay? You want to get as many A's and B's as you possibly can, right? Hopefully it's heavier in the A range. But as long as you're doing the best you can without compromising your personality, I think that's the best advice we could possibly give, right? Be yourself, do the best you can. Wherever you end up, it's going to be the right place. That also ties into something. So actually, right, you don't need to go to Stony Brook to get into Stony Brook Dental School. But Sean, I think you would agree, because Sean went to Stony Brook undergrad. There was a big percentage of our class that came from Stony Brook undergrad. Would you agree, Sean? Like, do you know what the percentage was?
So our dental school class was 44 and we had 12 Stony Brook students. So that's 1 out of 4. So that is a lot. I know for some students, it really didn't make a difference because, you know, they weren't really involved in the dental school as undergrads. So for them, they got in on, you know, the other areas of their application, which is great. For me, I was a person that was around the dental school a lot more because it was right there. We had volunteer opportunities to go there and meet faculty and meet students, and you know, you meet a bunch of people and you get to know who's around. So when it came time for applications, they kind of already knew who I was, and you know, maybe that played the same way for me getting into residency for, you know, in Stony Brook also. But you play the advantages that you have. So if you think that Stony Brook is a place you want to go, why not be there for undergrad, because you'll have so much greater access to the dental school while you're there. It can only help you. It can't hurt you. You know, by no means does that mean if you don't go to Stony Brook for undergrad, that doesn't mean you're not going to get in there for dental school. You know, that's not true at all. But I think for me, it provided an advantage because I had inside access to the place that I wanted to go to. So do some investigation for yourself. You know, and again, that goes into it. Is that where you want to be for undergrad? If you want to do business, Stony Brook undergrad is not the place for you to do business. that's fine. You can still get into dental school and major in business. Just go to a more business-oriented undergrad. That's more than fine. But if you want to do a biology or any sort of STEM stuff, Stony Brook is great for that. You know, NYU, if you want to go to NYU for dental school, NYU has a phenomenal business program. They're one of the best in the country. Go to NYU, kill it in business. That's going to be something so different on your application from other people, you know? Just my thoughts.
And by the way, going into business as an undergrad major and maybe minoring in business and majoring in the science courses as a pre-dental student, fantastic idea. Dentistry is, you have a better opportunity to be acclimated into business than in medicine. Now, you don't go into dentistry for business, but in order to keep the profession where it is, having more freedom than doctors, which is, I think, is a really important part of dentistry, we need people that are business-minded, like financial freedom-minded individuals going to it. Ax, how many people in your class are Stony Brook undergrads, if we can ask?
Yeah, I think it's 6, maybe. So 6 out of the same thing, 44 people. So like Sean said, they could give you an advantage in knowing the people, kind of exploring the area, maybe getting involved with research within the school. But I wouldn't make your decision based on that. I think it's something to consider. If you're dead set on Stony Brook, let's say you have lots of family on Long Island, for example, maybe it is your true destination, then I would definitely apply. But again, you have time. Like you said, you're a senior in high school, so you still have a lot of time to figure this stuff out. And I agree with what Brendan and Sean were saying in that if you want to major in something else, there might be other places for you. As long as you get those prereqs in, they're pretty much the same at all the schools, no matter where you go. So just make the best decision for you at the time.
I had a quick question. I'm also a senior in high school, and I'm looking to go into Queens College next fall. What prereq should I be focusing on, and what major should I be focusing on to make my career the most efficient in dental?
Yeah, so again, like we said, the major can be anything. So there's always that classic example of someone being a music major and then taking the prereqs in addition to those music classes. So that's kind of the extreme example. But in going into your freshman year, you always have to take intro bio. So that's usually 2 different courses, however your school structures it. For my freshman year of college, it was like population and organismal biology, and then also cell biology. So those were the 2 intro bio courses. There's general chemistry 1 and 2. And then I would also, during that first year, take calculus 1 and maybe statistics. A lot of schools are either calculus 1 and statistics as the 2 math requirements, or you have calculus 1 and calculus 2. I wouldn't recommend doing calculus 2 unless you're like a math genius. I just didn't think there was any need for that personally. So I did statistics and calculus 1, and then maybe get a writing course in there, because I know Stony Brook specifically, they need an English course and a writing course. So if it's not writing intensive, they won't recognize it. So that's another thing. As you're kind of considering dental schools, I would keep an eye on some of those prerequisites that are posted on all their sites' websites. They're not all the exact same. Some schools might need public speaking, some need English, some need writing. And while they're all similar and you kind of all do the same in the same classes, you need to make sure that the syllabi kind of line up in accordance with what the school is looking for. Anyone have anything to add to that?
Brenda, you go ahead.
I think it's a great opportunity to mention this. I just put in the chat the URL to the pre-dent mentor map. It's actually something that we created. We don't get any money from this. This is something we created for you guys. Now it's still in the beta testing phase, but I think at this point, because you guys could be all over the country. I don't know everyone on this call right now. But essentially what this map is, it shows you the location of every school in the United States. I think we have like 15 schools left to add. We're right there. We're right. Again, it's early on, but you could still use it. And what it does, there's filters on this, okay? If you go to the website, you'll see the map of every school in the United States. You can see where they're located. You can see their class sizes. You can see their tuition. You could see their average DAT score, among other things. Right? This is a really good resource to go to, and you can research the schools you're looking at, right? 2, just like what Ax said, some of these schools you have specific things, like I think Stony Brook required biochem and like NYU didn't, or vice versa, whatever it was. How are you going to know that? At Stephen, I graduated from Stevens undergrad, and there wasn't even a pre-dental group. It was just pre-med. So I was in a pre-med group trying to apply to dental school. I had to contact some kid I went to high school with to get any information. This is going to allow you to get in touch with current dental students at that school. Okay, we have a submission portal through that. It's in the tabs. If you click on, say you click on NYU, you could click the current mentors at that school, and you could submit to get put in touch with a current dental student there. You could submit 3 to 5 questions that you have for that school specifically. Are there any, unique application requirements that you need for this school, for Toro, for Buffalo, for Rutgers, right? How are you going to know this? This is what we created the map for. Sean, you want to pick it up from there? I think that was a really good point to include, but we could get back to Queens.
Yeah, I think it kind of ties back to what we mentioned before with Rob. It's what works best for you, what you're interested in. So do the research into the schools that you're looking for, see what their prereqs are, like Ax mentioned. But while you're an undergrad, explore what other things interest you. You don't have to, everybody assumes that you have to be a bio major just because you want to do, something in the medical dental field. You don't have to at all. One of our classmates was a botany major, okay? And she got into Stony Brook for dental school, and she got into one of her first choices for residency. So, God bless her. Do what makes you happy, but also keep an eye out for what the schools need. And then, you can always use that in an interview. They'll ask you about it. Why are you a botany major? And if you can explain why you're really interested in it, just like, Ax just listed off like 10 different things that, business, taste bud research. There's a whole bunch of stuff on his resume that diversifies. So there's a whole lot of things you can do. You don't have to follow a template. I'd say do what makes you happy, what you're interested in. Get into those pre-dental groups, like Brendan mentioned. Contact a mentor through the map. Just someone to give you guidance, to make sure, hey, did you take the DAT yet? That's something that I didn't think about when I was applying to dental school, and I had to scramble towards the end because I wasn't aware of it. You can somebody to keep you on track with your dentistry while you're doing things in undergrad that you're interested in. Be a well-rounded applicant.
And don't be afraid to take a gap year. Next question. What do we got for you guys?
Yes, I have a question. Okay, so I'm a freshman in college right now. I just want to ask if, what do you guys think is more important? Shadowing more hours and being involved in hands-on experience with dentists, or doing more of a research in college part? Which one would be more important on the resume, you think?
Totally all three. Number one is going to be your DAT score itself. Number two, you're going to want to shadow, be a surgical assistant or a dental assistant in one of those offices, because it would be nice to make some money if you're there that whole time. But essentially, you want to have a certain number of hours to show that you know what's going on in a dental office, right? You're going to need to be able to talk about it when you're on those interviews. Research is fantastic. Very few people asked about the research I did in undergrad on my dental school interviews. I'm not going to say don't do it. It's something. Here's the thing. You're going up against half or more than half of those applicants to dental school probably did research in undergrad. Ax, did you do research? Sean, did you guys do research?
In undergrad, no, I didn't.
Okay.
Yeah, I did. I'm happy to talk about. Yeah. I did it for credit. Yeah, I did it for credit too. So that's something to consider if your school does that. So you can either be paid or for credit in most places. I did it for credit because my PI said, do you want 3 credits of an A, or I could pay you minimum wage? And I was like, I'll just take the A. That was me personally.
A lot of schools actually do it that way. I had it for credit, and I started a semester earlier for not credit. But just to keep in mind, everyone's going to have research on that. You're probably going to want some form of research experience on your resume, although it's not necessary.
So there's a question in the chat. Does research need to be science related?
I'll defer this to the guys that did the research in undergrad.
Yeah, so I was responding to the comment right above it. So in saying absolutely, it doesn't it could be anything. So it does not need to be science related. They want to see that you're a good member of a research team, that you're punctual, you're reliable, you're able to work with the graduate students or the PI and kind of do whatever it is necessary that group requires you to do. You don't have to be curing cancer. Okay, you can be kind of pipetting at a lab bench. You can be helping with a literature review, for example. So it really, the involvement can vary, and it all depends on your schedule at school. If you really do want to take on that major role and maybe be a first author on a published paper, by all means, if that opportunity is in front of you, you might as well go for it if that's something you're interested in. But like I said, the involvement and the scope of the research can really be anything.
And that being said, you know, if you want to take a poke at curing cancer, it might look good. It might, you know, if you do,
it won't look bad.
It won't look bad. But to Axe's point, yes, you could do research in anything, but keep this in mind. On your resume, they're going to see that you did research, right? So great, knocked it off the list. But if they do ask on your interview about the research you did, no matter what it is, whether it's dentistry related, medical related or not, you need to be able to relate it to something that interests you for dental school, right? That's an interview that you got to be able to relate it to dental school, dentistry, your passion for your goals, right? Simple stuff.
A housemate, I live with 4 other dental students, so we have a good mix. We have a Queens College, and then someone else that's relevant to this point is that he took a gap year, and he was working on a paper, and he did research on frogs. So could be anything.
Again, guys, as long as you're passionate about it and willing to talk about it during an interview, you can do anything. You can do anything, but, you know, just make sure that it's something that, you know, when you care about, you're willing to talk about. And, you know, if you can relate it, like Brendan said, to dental school, it's just easier that way. But if it's something else that, you know, that isn't related to dental school and you can find a way to tie it in somehow, by all means.
And off that point, the last thing is, I think really what this comes down to is your level of passion for whatever you're doing. So you go to an interview, I mean, everyone's going to have the same check boxes. They want to see that you're fulfilling the check boxes in ways that make you excited. You know, they want to see that you're able to articulate your research. They want to see that you were, you know, like I said, a good member of a research team. It really can be anything. Be passionate about it. And that's what it's all about.
Sam, you know, you did a wonderful job of putting this together tonight. Do you have any questions we could answer for you specifically too?
Thank you very much. As far as questions for me, you know, I honestly am just here to kind of, you know, help better guide like other students. So really, I feel like what would be helpful to the majority of the people here right now is kind of maybe take us through like a day at dental school, you know, the curriculum, you know, once you're already in there, like how does it look? How do you manage your time, etc.?
Well, I'm happy to give my 7-week synopsis of year 1. And then maybe the 2 of you can fill in 2, 3, 4, if that's good. So year 1, there's orientation. You get there, you meet all the people in your class. Stony Brook is a small program, so there's 45 of us. And you're kind of doing those basic sciences that first year. So I'm currently enrolled in Molecular Foundations of Medicine, which is a biochemistry course with an emphasis on disease states and certain, you know, pathologies and things like that. And then I'm also involved with an anatomy course, a gross anatomy course with cadavers. So if you've taken an anatomy course in undergrad, most of the time it's been PowerPoint slides, which is what I did. And then you walk into the cadaver lab for the first time, and it's a shocking experience, but then you get used to it. And it is a really, really surreal experience if you're able to work on cadavers, and that's something you should look into if your dental school has that opportunity for you. And then I'm in some communication courses and patient communication courses right now, as well as dental morphology. So that's understanding the anatomy of individual teeth. And a component of that course involves waxing up. So you take a peg, a little piece, and it fits into a typodont, which is kind of like this looking structure, and you put it and you sculpt out of wax each and every tooth along the way throughout the semester. And so that's a really great way to learn every little bit and piece about every single tooth. And so, for example, and then this is also, I have a skull exam on Monday. So I was studying the human skull and all the different parts of the anatomy. So that's all I got for year 1. And then Sean and Brendan are going to fill in everything else.
Dude, that was a walk down memory lane. Holy moly. Brendan still got a skull. Funny story. I don't know if yours, Axe, is a real skull or if it's like a fake one.
It's the real one.
Yeah, it's a real one. I
Yeah.
studied with a friend of mine in the city during that skull quiz, and I came in like a lunchbox. And I rode the train with with a lunchbox with a human skull. And I'm thinking, like, if somebody were to ask me what's in this box, and I was like, yeah, I got a human head in there, like, scare the crap out of some people.
Yeah, I usually study at Starbucks, and I don't think I can pull this out.
Yeah, right. Like, you just whip out
it's,
like a human head, you put it on the Starbucks table.
this and my pumpkin spice latte is not going to work out.
It's nutty.
All right.
Although it would go good for Halloween, right? You know, people
Yeah,
think
sure.
it's a decoration.
Question.
Creep with a skull next to his pumpkin latte.
He's just really passionate about Halloween. So Axe, that's really the beginning of first year for dental school. No matter where you go, is going to be the introduction to. At first, it starts with the health sciences in general. For certain schools like Stony Brook, there are other schools that are associated with a medical school. So you may or may not take medical school courses in addition to early dental school courses as a background. So Stony Brook does have dental school courses. I know medical school courses. I know there are other schools that don't, and they kind of brush that stuff off a little bit earlier. As you go through the year, you'll progress into more basics into dentistry, the different facets of dentistry, whether it be periodontics, growth and development. And that you just kind of go through the specialties. You go through operative training. You start learning how to drill teeth, how to drill preps, how to take out cavities, how to restore cavities. You start building the foundation. Second year, again, you start learning a little bit more foundations of dentistry, going into each specialty a little bit more. You'll start getting more hands-on experience in terms of prosthodontics, drilling crowns, dentures, a little bit more in-depth things, so that things like tooth anatomy become second nature to you. So that when you're putting together an entire denture, you understand why things need to go where, and you'll kind of process that information without thinking about the anatomy because you'll already know it. So you'll lay that down first. And as you go further on, you'll start working into clinics slowly and seeing patients. I'm sorry to keep making this a Stony Brook conversation, but we do get into clinic at about halfway through second year. You start with, basic patient exams and start working your way forward, maybe a couple of, cavity preparations and whatnot before you start getting into clinic. For most schools, by third year, you're kind of into clinic, I'd say maybe about 75% of the time. You're in clinic with a couple of other classes. During this time, you're also thinking about boards and whatnot back and forth. And by fourth year, you should really be in clinic full time. You should really be, if you're thinking about doing general dentistry, you should really get the feel for what it's like to be a general dentist, morning and night, drilling crowns, restoring teeth, doing root canals, extracting teeth. So fourth year is really where it gets into the nitty gritty full time. You kind of get a feel for it third year and a little taste of it second year. But all those things get easier when you build a solid foundation from the start in first year and you build up for it as you go. I'm going to just quickly touch on the financials aspect before I toss it to Brendan. Look into each school that you're thinking of applying to and think about the financials of it and how they structure, tuition versus in-state, out-of-state. Is it a private school? Is it a public school? All those things, because dental school, no matter where you go, is incredibly expensive. It doesn't matter where you go. Stony Brook is a cheaper school relative to other schools. There are schools cheaper than Stony Brook. There are schools significantly more expensive. You have to think about that. That's why, maybe you can get into dental school right out of undergrad, and that is great for you. But if you need to save up some money, to pay for rent, to pay for gas, to pay for groceries during the week, then maybe take a gap year or two, save up some cash so that you take out less loans. For Stony Brook, it's about $80,000 a year in tuition and fees all associated. And I think that includes, for the most part, cost of living. There are other schools that are more expensive. Let's say private schools can cost up to $100,000. For Stony Brook, out-of-state people, that is $100,000, not including the cost of living. So, all those things are something to consider. At Stony Brook, we buy our equipment, so we own it after 4 years. So all of your drills, hand pieces, all those things are our property. So we paid for it, but we get to keep it for the future. In other schools, you rent it. So you pay the same fee, but you don't take it home with you. So, some people want to keep it for their private practice. So some people want to sell it on eBay. All those options may or may not be available to you. So definitely do the research, use the map. The map that Brendan mentioned earlier, does have a feature to filter schools by finances. So you can lower it based on tuition. In-state and out-of-state are both available. So look into it, guys. If you're early on if you're early on, do the research into the schools that you're interested in and the areas you might be interested in, because it'll really change how you apply, and it can save you a lot of money. You know, applications aren't cheap either.
Yeah, because you got to look at that. I thought NYU's up to close to 120 a year now. It's way up there, and some of those, they don't even include cost of living, because cost of living out in Stony Brook, in Buffalo, is a 180 as far as differences goes from living in Manhattan. Completely different. I'll tell you right now, because I was living in Stony for 4 years, and now I'm across the street from NYU Dental School with oral surgery. Oh my God, the rent about in between. No, it's 5 times as much. 5 times as much a month. That's a big bite to swallow. Dental school tuition is a big bite to swallow. Sean and Axe both answered very well about like the daily life in dental school and everything. The one thing that I would relate to undergrad is undergrad, you kind of have a lot of your time to yourself, and you have classes spaced out. In dental school, you have to anticipate that you're going to have to get up. You're going to have to be at the facility by 8 every single day. All right. You're probably not going to get out until 5 every single day. That entire day is blocked. Okay. This isn't remote learning all the time, right? Dental school, you're going to have to do some things hands-on. You're going to be working with patients. That's a full day. I miss college. Let's go back to the tuition thing. Financials, guys. In 2020, the average debt that dental students had in the United States was just over $300,000. That's a really big thing to keep in mind. This is a big investment. You can and will make it back if we keep dentistry where it is today. But let's just throw out some data there. Regarding living costs, how do you guys personally pay for it? Another one just came in. Jesus. Do you work, or if this is something saved up for? For me, a combination of that was Axe. Axe works. I'll go into me. I worked as a lifeguard every Sunday morning. Guys, I wasn't paying off dental school off of $12 an hour. All right, it wasn't going to happen. But what was going to happen was I forced myself to get up early on Sunday mornings. I had 5 hours at the gym. I was lifeguarding, but I was studying in that time. I was getting paid to study at the pool on my table at the time, and I got a free gym membership.
4 people drowned, but it was totally fine.
Oh yeah, no, only 2 people drowned. It was fine. No. It was a 4-foot deep pool. I would just tell them to put their feet down. But guys, like, what I would recommend, look into lifeguarding. Look into being a librarian. You could sit there studying the entire time and make some money for that. You're not going to pay off dental school, but guys, that could cover groceries, gas. You got to be wise about it. Any other tips like that, Axe? Why don't you tell them what you do? The balloon twisting.
Yeah, it sounds crazy, but since I was 11 years old, I've been professionally performing at birthday parties, block parties, bar mitzvahs, communions, weddings, and I'm a professional balloon twister. So like, it's not just like dogs and swords. It's like literally anything you could think of, literally anything. So for some reason, I'm 22 and I know all the characters of the Peppa Pig show. I got to know all these things because all the kids are always asking for very specific characters from movies and TV shows. So that has been a really lucrative thing for me where since I was 11, I'm working 6 parties a weekend during the summers. I'm actually able to still balance that while being in dental school. And one of the things I thought about in choosing Stony Brook was I'm still in Long Island. I still have my clientele. I'm able to work parties here and there. So that's something that I'm able to do for income on the side. And I think Brendan kind of hit all the points. The librarian gig is a good one if you can get it, because you're sitting in a quiet place. No one's ever taking out books, right? No one does that anymore. So you could sit there at the table, you could study, you could do your stuff and get paid for it at the same time. So definitely something to look into as an undergrad job.
Exactly. Bingo, guys. You got to think outside of the Axe. Can you do the characters from Moana?
I got you.
Yeah. All right,
I
had to make sure.
Yeah.
For me personally, I do live mostly on my loans. I do take out loans every year, and I do live off loans. I am more frugal with how I spend money. When I go out, I don't go out every weekend. I don't go out, I don't go on vacations a lot. I don't do a lot of those things because I understand the interest rates that are on these loans, and how they work. So, you do have to be smart with it. I'm not saying I don't buy myself anything, but, I am very conscious of what I spend. And at the beginning of each year, when I do take out my loans, I calculate how much I'm going to need. for the year for miscellaneous spending, gas, groceries, whatever. I did work as a work study student at the dental school, so work study is something that can help. So I worked in the orthodontic lab where I'm now a resident. So that was also a means of me to meet the faculty and residents of the program I wanted to go to. So I got paid, I think it was like $10 or $12 an hour, something like that, for an hour of work to go and hang out in the lab and go assist and clean up and do some other things. It was an excuse for me to go into the ortho clinic where I wanted to work. So that's what worked for me. That also, just like Brendan said, it helped pay for groceries, it helped pay for that, to fill up the tank of gas on my way home. So it was small things, but for big things like rent and stuff like that, it's mostly coming on loans for me. Question in the chat on would you recommend assisting while in dental school? If you have the time, 110%. If you can balance yourself the way Axe does and work on weekends and still kill it in school, by all means, highly, highly, highly recommend. That's where you have to recognize yourself as a student and see what works best for you. For some people, if you can balance it, all the power to you. Go out there and make some money and do well in school. If you think that you need more time in school and you need to study a little bit more, to get that solid foundation for the future, as much, as hard as it might be to process in the moment, each of these things is a small amount for what could, be a very bright future. So if you have to sacrifice a little bit more now, take a little bit more loans out now to really do well in school so that you get the future and the career that you want. If it's a specialty, if it's a GPR program, a general dentistry program in a certain area, if you want to go to a certain school, then, maybe sacrificing a little bit now and, having it pay off in the future is what works best for you. That's what worked best for me. And, that's where I am right now. But, Axe is doing well. Brendan did lifeguarding for 3.5 years before COVID hit, and he was there every Sunday. He didn't miss a shift. So, it's just what works best for you.
That was well answered. Let's keep going with questions. What do you guys got?
So if you guys don't mind, Isabel?
Oh, hi.
Yeah, go ahead.
Question for you. So, hi, I'm Isabel. I'm a senior at CSI. I kind of started the process late because I'm a transfer. I didn't have any guidance from anyone. So I didn't even know that a committee letter was necessary. So I haven't done any of that. So I'm gonna have to take a gap year. But I plan to do Navy Dental. So they'll pay for all my school. I just serve for them. But I was wondering if you guys can explain the application process for me.
Axe, take that away. You were most recent in that.
Yeah. So my school also used a committee letter. So are you planning to use the committee letter, or you're trying to get individual letter senders to send to the schools?
I don't know.
Okay. So if possible, I would go through your school's committee letter program, whatever it is. So I know that a lot of people who take gap years are able to go back to their school after they graduate and then still have them write a letter on their behalf. It looks a little better if the school can put a stamp on it than it is if you are having individual letters be sent. I've heard that it can look like you're trying to cover something up if your school offers a committee letter and then you don't take it. But in your situation, it's different, and it's very obvious that you've obviously been a transfer, and you can kind of fill in the gaps there. So I wouldn't use that necessarily. But if you can do the committee letter program, look into that. That's the first thing. But then the application process, and even Sam can kind of jump in here too, because he's in the middle of it. You're going through ADSAS, which is basically the central application service that you use in applying to dental school. And maybe you could fill in some of the timeline, Sam, for me. But essentially, personal statement, GPA, DAT score. Those are kind of the big three. And then within this application service, what you're going to have is you have supplemental essays. These are either offered to you at the time when you're initially applying to the school, or they're sent to you at a later date. So each school kind of varies, but this application service is really great. It's all in one spot. You could see the progress and the tracking for your application within each of the individual programs. So that's that. In terms of the timeline, Sam, you want to take this one?
Absolutely, yeah. So Isabel, Brandon, perfect. Like do exactly what he said. But I also actually have, since you're at CSI, some extra advice for you. I highly recommend going to speak to Grisdina Yilmaz. She's the clinical coordinator. So you definitely should follow up with her. She's going to guide you through, the whole committee letter process and opening up a pre-health file. As far as, like DAT, all that stuff, you should do exactly what Brendan said, go through the ADSAS. I'm sorry, I just got sorry about that. I got some notification. So go through the ADSAS, you want your personal statement, DAT. I mean, as far as timeline goes, you really just have to understand when you plan on applying. So for example, let's say you want to take a gap year, you want to enter dental school, 2023. Then you essentially want to apply like this time of 2022. You understand? So as long as you have your personal statement, your DAT, all those things, your committee letter done, and you send it through ADSAS within this time range, you should be fine. Do you understand what I'm saying?
Did you take your DAT yet?
Isabel?
No. So that's the thing is like, I really need to, because right now, I'm a two-sport athlete right now. So I don't have much time and I don't have any research. So I know it's like your application is about being like a well-rounded individual. So I'm hoping that kind of helps in that sense. But I'm looking for like where to go to get like, I believe today they said something about the DAT destroyer. So stuff like that. But
yeah, so I can speak.
Sorry. Hi, I'm Kayla. I'm from CSI as well. I'm the president of the pre-dental club in our campus. And I actually saw your message that you messaged me about your information. And actually, I'm able to speak with Professor Yilmaz regarding your case because sometimes she has a lot of students and she's not able to get back to you as soon as possible. But since you have a very specific case, maybe she can see you as soon as possible. But on your case regarding, since you're a student athlete, the thing is, with a committee letter right now, they're making a lot of requirements and they're really being harsh on students because a lot of people, they're not being so serious. And apparently now you have to have 10 hours of of being active in the pre-dental club. So you being a student athlete, it's hard for you to attend our meetings. But you can tell her that you're a student athlete, because honestly, you're a very diverse case when it comes to dental school. There's not many people who do extra things like sports, which is great. But they're requiring a lot of things. They're for a committee letter, they're requiring students to do research hours, volunteer, and one of those things is to be active in the club, which you haven't. So, when you speak to Professor Yilmaz, do mention that because, she might make an exception for you. But for CSI committee letters right now, they do require students to at least have 10 hours of being active in a club, which is basically attending meetings, which our meetings are basically like 2 hours. So maybe if you can next semester, try, but that's the case, do mention that to her, and I will reach out to her and tag you in the email so she knows your case.
Okay.
Well, this has to count as an hour, right guys? This got to count.
Of course.
So there you go, Isabel. You already got it started.
All
what
right.
were you gonna say? I want to follow up with that, but yeah.
I already spoke to her over the summer and she told me essentially that I need to get 3 years worth of stuff done in 7 months to apply. And I was like, whoa, that's not for me. So
sometimes she can be a little rough and not understanding of your case.
Oh,
but
yeah, I got that.
Do your DAT whenever you have the time. Don't rush it. Do everything on your own time because you're the one who knows what you can handle. So as long as you have all the required things that you need for the committee letter, do not worry about what she says. As long as you have everything you need, that's all you need. That's it.
So just to jump in real quick, honestly, I do agree with Kayla there. Isabel, don't worry. Focus on getting that DAT. Focus on, building up your application. Getting started on your personal statement. And as far as whatever Yilmaz says with like time and stuff, don't worry about that. You'll be fine. Just focus on yourself right now.
And then the last thing, sorry, we were talking about a little bit before. In terms of DAT prep, we mentioned DAT destroyer. I was not a fan of DAT destroyer. I thought the questions were way above level and they didn't really give a really great explanation for when I got things wrong. I also prefer doing my notes electronically these days, and that's the Destroyer books are all physical copies. So that kind of depends on your preference. But what I did was DAT boot camp. I'm sure you've heard of it. They're kind of all over the place. Excellent, excellent, excellent. I have only good things to say about it. Everything is all in one place. It's on this nice website. And I wouldn't, there's a schedule. There's a 10-week schedule. I think it's a little lofty to try to do the schedule in 10 weeks because that's assuming you have like nothing else going on. I was studying for the DAT as a junior, and I was taking physics, biochem, and a few other things that it was the worst semester just because I was constantly working. I would wake up at like 5 to do DAT until my class was at 10, and then I would do all day of class, and then I would study. But regardless of when you find time to study for it, DAT boot camp is probably your best bet.
I'm gonna jump in here real quick, Brenda, before I toss it to you for the gap year thing, because I think that's really important to cover. But DAT Bootcamp, great resource for me. DAT Destroyer worked really well. I actually really liked it. I'm a handwritten guy. I'm not an electronics guy to Axe point, so I wrote down all my information on there and I really studied that thing. I have no idea who this professor is, whoever she is, but I'll just tell you now, they're in charge of the committee letter. Again, I don't know who she is, but from my experience from other friends and classmates around a bunch of other schools, these people don't know everything. I've had them tell a bunch of friends, you're never getting into dental school. You should wait. You should go and do a post-bac or a this and that. They really tried to mess with someone's head and they applied and they got it. So, you can always listen to advice, but you best. And what's the worst case scenario? It doesn't work out. Yeah, it might bite you in the wallet a little bit, but otherwise it's okay. You do it again. It's totally up to you. I just wouldn't take their advice as the end all be all. You know yourself a lot better than they do. So Brendan, let's hear about this gap year, because a lot of people, have such a negative stigma about it. And when you get to dental school, it's actually the exact opposite. So I think it's really important to cover.
Definitely. There are a couple of things. Also, in addition to DAT Bootcamp and Destroyer, there's also I'd say for me, by far the best PAT studying tool was Crack the PAT section, the PAT section. 100% do that. Learn it on your own, whatever. But well, first of all, it sounds like that. Like, isn't that the person's job is to get the committee letter going for you and get as many people from your school into dental school and medical school as possible? Sounds like she doesn't want to do her job. It's okay. Everyone's getting this way with the whole remote learning process. It's fine. But the fact is, Isabel, I don't want you to get don't let anything steer you off your course. And there is no such thing as getting into it late. No, I was in the same exact boat. I was a college athlete. I played basketball in college. I didn't realize until the first semester of my senior year of college, because I shadowed that entire summer before my fourth year of college. I figured out, okay, this is definitely what I want to do. I don't want to go to medical school. It's dental school that I want to do. And I had a knack I wanted to do oral surgery at that time. I knew it, right? That's not too late. Everything worked out, right? It's your path. It's not someone else's. So what I'm trying to say is, don't be afraid to take a gap year if you need to. All right. Whatever she said, 7 months. No. Just knock off one thing at a time. Get a nice list going. Check one box off at a time. DAT, 10 hours at the club, one at a time. Steer your ship, and you will make it to the destination. Okay. If you crush that DAT, she's going to have to write your letter. It's going to have to be fast. All right. Let's put it that way. There was also a question, and my gap year was great because I graduated. This relates. If you do have to take your gap year, what I had done as soon as I graduated that week, I started studying for the DAT. I had less than 2 months, took the DAT, and then applied. I got into the school that I had to get into and started the next year. It was just one gap year. And what did I do? I was able to read books on financial planning, look into entrepreneurship, produce music. I worked 3 different jobs, 2 lifeguarding and as a surgical assistant at an oral surgeon's office. Now you get your time. I'm a big advocate for a gap year or 2. Some people take 2 gap years. This is your time. It's an in-between phase where you're locked into dental school and you just finish being locked into undergrad. You get to learn about yourself and you get to learn about the world you're in. You're going to want to know how to navigate through that world you're in, right? So this is besides the point, but if you're in a gap year, use it to your advantage is what I'm trying to say. In the chat, we have, how did you study in undergrad? This is such a good question because the first year, it took me took me a year and a half to figure how I studied best in dental school. But let me tell you guys something, it's completely different from how I studied undergrad. I was a written guy. I'd write all my notes out. I'd go into a test and then I'd take the test. In dental school, you don't have time to write every single note out 3 times. You might just be reading it. For me, I figured out I'm visual. I need to put a figure on a Quizlet card and then go through it like 3 to 5 times. I could do all that the night before an exam, right? You need to learn how you study best. So studying undergrad is one thing, but just remember, the doors open up when you get into dental school. Do you guys want to touch on that at all? I think that's...
Ax, you go first.
Well, that pretty much sums it up for me. I would write these really great notes. I would write it on pen and paper, but I just don't have the time for that anymore. There's too much going on. So I even have a class, MFM, Molecular Foundations of Medicine, which is you guys were in, obviously, where what the lecturer talks about is not what's on the actual exam. It makes no sense, and I actually am struggling to even understand how to study for this class. But what's happening is basically I'm using Anki. It's a flashcard app. If you aren't familiar with it, it uses like a spatial repetition premise where the cards are presented to you in a way that kind of works best for your brain. There's a lot of studies on it, but it's not like I don't really know anything about it. I just trust the process and I go through the cards and it's working. But like we were saying, it's hard. You can't know everything because it's just so much information all at once. Sean, anything to add?
Yeah, to both of your points, it might be, a little jolting to hear that, the pace of dental school is significantly faster than undergrad. Like I just said, I'm a handwritten person. I would handwrite everything until I got to dental school. The first 2 months of dental school, I would sit there and I would try to handwrite I would print out the lecture slides, points on a piece of paper, and I'd sit there with my pen and I would try to write down as he's talking. And Dr. Rem would fly through MFM, and before I could get half a word on my paper, he's 6 slides down. We covered an entire semester of biochemistry in undergrad in a week. Some of it was, you fly through it. You really go fast. And this is something that Ax is going to learn, that you will find out the best way to pick out what they call the high yield information, the information that pertains to the exam, because they have to teach you the entire course. They have to teach you everything there is to know about biochemistry, whether that applies to the exam or not. They're going to cover it. So you guys will learn how to pick through that information. For Brendan, it's visual. For Ax, it's visual. I'm more of a visual person too. It's funny, in undergrad, I was a lot of memorization. I would sit there and I would read and write until I could basically go and spit it back out on the test. And as dumb as this sounds, when you get to dental school, if you don't understand everything that you're doing, the next 3 steps are going to be 3 times as hard, because you won't know what's going on. You don't have the time to memorize the volume that they give you. The only way to get through it all is to really understand it. For me, it's a combination of hearing, writing down certain points that are, maybe difficult to understand, looking at diagrams, speaking with friends. Me and Brendan used to study together all the time. We'd do our own studying. We'd get down, we'd come back like, all right, I don't understand this point. Does this make sense to you? All right, it does. Brendan, can you explain it to me? And we would do that. We'd go back and forth with that with some of our other friends. So, there will be ways in Ax. We still have to go over, how we study in dental school. But yeah, find a way that you can understand the information, not just memorize it. If you feel like you're memorizing the information, it's not going to be enough for dental school.
Yeah, just one more thing. Group study, I'm finding out that is something that is really, really helpful, because like we were saying, it's a lot of things all at once. You're not going to master every concept the first time you hear it. That's something to keep in mind. But I mean, it sounds like a lot. Like we just basically told you all, how much work it is. And you've probably heard it's like drinking from a fire hose, which it is. I'm finding this out as we go, but it's not impossible. And you just think of the times in undergrad where things seemed overwhelming. You got through it. You still have the same brain that you had in undergrad, except now it's a little older, and you're able to do it. It's not impossible. And
I'm sorry to cut you off, Max. This is actually really amazing as you go through how much faster you'll be to pick up information than you are now. It's crazy that for right now, for Ax, it might feel like it's overwhelming. Dude, in a year from now, you're going to look back and be like, wow, I wish I was in biochem again, because I would, it would be a cakewalk. because they're going to give you so much that you'll be able to process it all faster. And there's a question in the chat as to if we get a review sheet or verbally given the topics that we should study for. I'd say 90% of the time as you go through it, probably not. Certain professors are a lot more forgiving and a lot nicer. Certain doctors are more understanding of the stresses of dental school, and that they genuinely want you to learn the important things. They know that they have to teach you everything, but they'll tell you, hey, listen, these are the key facts I want you to actually know for your future. So this is what you should study. But there are only some of them that are like that. Some of them are a lot more passionate, let's say, about their field, and they want to show you why it's very important, Dr. Frost. So, you know, they'll give you everything and expect you to know everything. So is there really a review sheet? Not really. You just kind of got to go through the information and get your way through it. I'm going to read the question, whichever one of you guys wants to answer. What tip would you give for studying material in dental school that I should start implementing now? I know Brendan was a big Quizlet fan. Axe is an Anki fan. OneNote. What was the other one? The writing thing. What was it?
Good notes, notability.
Notability is great, guys. It's a digital notebook. If you use it or not, you could actually record the lecture too. Record as in, like, while you're taking notes, it could record the professor or doctor in the front of the room talking about it. That's great for taking notes and whatnot. But the fact is you need repetition to study these things. So the best thing I would do is I would import the presentation into Notability. During the lecture, I would be annotating on top of that lecture in Notability of what the doctor's saying in the front of the room that isn't actually on the slide. And now everything between the slide itself, everything that was mentioned in the class is now in this document. Then I go home at night, sometimes it's like the next week because you have 5 exams, putting that into, for me, was Quizlet, right? I would just screenshot whatever figures are on that slide. And now you have the visual. Sometimes you could memorize to one visual. You could get like 10 to 20 slides of like facts to one photo. And then I would just study that. I found that instead of writing things out 3 times, like I would have to do in undergrad, I would just go through a deck 2 or 3 times, like a Quizlet deck, with figures. With figures is so important. You'd have to pay for it. It's $20 a year. That's nothing. Do you want like all A's? Like, yeah. That was the biggest thing for me. Very, very big. Just screenshot it, throw it in there, throw a couple of facts on the other side, do it again, and then run through that the week before the test, the night before the test. When you get good at it, it's going to be like the morning before the test. Oh my God.
You said you use Quizlet?
I do use Quizlet, yeah.
Okay.
Quizlet.
All right.
I just threw a link in the chat. The new kid on the block is remnote.io. So look into that. It's essentially note taking that when you take notes, the flashcards are already made. So it does 2 things at once, and it's excellent. And it does spatial repetition. So instead of transferring notes to Anki and then doing it, it's all in one spot. It's really great. I'm still like slowly starting to work. That's kind of the resource rundown. I think I also want to address the question based on kind of how you should live your life. And I think something you could do as a senior in undergrad is like figure out when is best for you in terms of studying, because staying up till 2 a.m., 3 a.m. might not really be the solution in undergrad. I don't know if I would be able to, because now we're going in person again. My last year of undergrad, I was able to just like lay in my bed and do my classes, and it was like kind of whatever. Now it really matters. And I don't have the same energy that I had in freshman year of undergrad, where I was doing these like crazy all-nighters. It's just, you're not able to function the next day. And it's different because you actually need to pay attention in class. I at least didn't really pay that much attention in undergrad. And then 3 days before the exam, I would rewatch all the lectures and kind of get it. You have to be on it all the time. So that's something to think about. I figured out after I started studying for my DAT, I am a morning studier. I need to get up at the crack of dawn. I need to go somewhere. I need to be at Starbucks. I need to be somewhere where I'm not sitting in my room. That's what I figured out. And that's something that's a good habit to get into, especially for dental school.
It's funny that you say that, because I'm the exact opposite. I need noise. I need people around. If I'm alone, the TV is on all the time. Football Sundays, I'm sitting there from 10 a.m. to 10 p.m. and the game is on and I'm doing work the entire time and it just works for me. I don't know, when it's dead silent, I get stir crazy. I can't do it. So that's just me. But yeah, I don't know. Next question in the chat: tips for interviews. Before we get to that topic, something you could have done in undergrad. We'll get to the interview question, and I'm gonna let Brendan and Axe get to that because I think they're able to articulate it better than I am. Something I wish I did in undergrad. I wish I took advantage of my free time more. Did a little bit more investigation to dental schools that I was interested in, because I wasted a lot of money on schools that my application didn't match. I didn't have research. I applied to a couple of research heavy schools without really thinking about it. That was a waste of like $400. And enjoy yourself. You're going to study hard. You're going to get through all this stuff. You're going to do all the things that we talked about in terms of how to study and use, remote IO or Notability, all these things, but enjoy yourself too, because you'll never have as much free time as you do right now, as scary as that is to say.
I think what that means, I remember when I was the summer before dental school started, or the year before, I was contacting some current dental students and they were like, enjoy your time. And like, what does that mean? Looking back, and what I would do is, I think what Sean's trying to say is you got to be able to differentiate when it's go time, when it's studying for finals time, studying for midterms time, or when it's just like, it's not the week yet. I'm going to enjoy this week. I'm going to go to that party. I'm going to go to lunch with the girls, and then I'm going to study next week. That's all in time. You need to be able to differentiate that time, because if it's all go time, you're going to burn out. We don't want that to happen. You want to go, Axe, why don't we go into, or yeah, Sean, you answer this great too. Let's go into interviews. You got to figure out if the interview is going to be in person or virtual. They're two very, very different things. If everything's virtual, then you're going to be able to go to all the interviews. If everything's in person, you're going to be able to go to maybe, if you're lucky, half. This is a whole conversation itself. Get tips on interviews. Dress the part, play the part. Don't over prepare for an interview. At the end of the day, you are going to have a conversation with your interviewer. Okay. You're going to be talking about fishing. Like I was telling my guy in Buffalo that my dad loves to go fly fishing up in Canada. Right. And he was loving it because he did too. It was perfect. Right. It was a conversation. It had nothing to do with dentistry. Remember that. You want to be able to answer the four main questions. And this is for residency interviews as well, guys. Tell me a little something about yourself, keeping it brief, and about who you are, things that are relatable. Like I played the violin, and turned out a bunch of oral surgeons were guitarists and like bass guitarists. Relatability is very important. Your experiences that you can relate to dental school, and then summing it up why they want you at their school. Give an indirect little something about yourself. Why dentistry or our dental school, right? You could call it the same question. Tell me a little something about what's your biggest strength and what's your biggest weakness. This needs to tie into experiences and reasons of why you want to go into dentistry and why you're fit for it. That's really important to get across. You want to dress the part. So like if it is a virtual interview, don't wear underwear on the bottom. Do the full, tie up your shoes with the
wear underwear, just not only underwear, probably.
Yeah, exactly. Okay. Or go commando. It's fine. Dress the full part, not because they're necessarily going to make you stand up and show what you're wearing, but because you need to be in the moment. You need to be confident in yourself and your presentation, and you will. This is a long topic to go into.
Quick thing that you say that, Brendo, about standing up. Stony Brook professor Dr. Wynn, who does interviews virtually, makes males applicants stand up and spin around to show that they're wearing pants. All right. It's a professional interview. You are interviewing not just against dental school, you're interviewing to become a doctor. And that's something you should take seriously. How hard is it to put on a pair of pants? You put on a pair of pants, a skirt, whatever it is, and you sit there and you do the interview for an hour and you take it off. Just for yourself, that, like Brendan said, you're in the moment. You are in an interview to become a doctor. Something quickly before I toss the axe. When you talk about virtual interviews, look what's going on behind you. That might not be something you think about all the time, or what the presentation is for what you have behind you. Like I'm looking at my screen right now and I see, it's pretty empty. It's basic. It's got, the window on one side and, my shelf on the other side. Brendan's got his cool lights, his tapestry. Axe has the blue moon and the hats and all this stuff, so whatever you present behind you, people are going to take note of it. And you can use it to your advantage. Like Brendan said, he put the violin within eye shot of, you could put it right behind you during interviews. People will ask you about it. If you put up a fishing pole, maybe somebody will ask you your tennis racket. Somebody will ask you about that. Isabel, you said you're a two-sport athlete. Maybe you put up something back there that is about your sports. Oh, you play softball or you play basketball, whatever sport it is. That's a way to, kind of curve the interview into something you'll want to talk about. So, maybe somebody won't comment on it, but, if they do, that's a slam dunk for you. So keep in mind what's behind you. I've seen people when we went to interviews that had their beds behind them that weren't made. They had their clothes all over the floor. It's simple things that show that you care that go a long way, especially now when things are virtual. Axe, what was it like to apply to dental school in the virtual age?
Oh boy, it was I was lucky to have two in-person interviews, which were Toro and Rutgers, and Sam just had his Rutgers one. I definitely agree about the background. I saw some weird stuff going on in some other people's, and I just recommend keeping it as normal as possible. That's the background. Secondly, let's talk. I liked what you were saying, Sean, about kind of taking the interview where you want it to go. That shows that you are confident, but it also makes it easier for yourself, because I mean, these people, right? They're taking time out of their day. They're full-time dentists, whatever the case may be. They're hearing the same thing over and over hundreds of times. They hear, why do you want to be a dentist? Oh, it's the perfect combination of this, and that. Like, oh, tell me about you. They already know about you. So they're willing to talk about other things. I talked about for 15 minutes with the dean of admissions at University of Pennsylvania about sweet potato fajitas. Okay. So they really are willing to talk about anything. That's the next thing. In terms of preparing for the interview, Brendan really had the 4 questions perfect. And they were basically, tell me about yourself, why dentistry. I would also throw in there, like, why not medicine? I was asked that a few times. Strengths, weaknesses, and also tell me about a challenge. That's something that you want to think of when you're preparing. But in terms of thinking, so let's say you have an interview at Stony Brook, you want to know why Stony Brook. Okay, you want to know why that specific school, and not something that's on the website. They know what's on the website. They know they have a mobile clinic that goes around to disparaged areas, etc. They try to connect it to something within your application, and then some of the back end work that you can do. I would go on. So our pre-dent mentor map is basically serving the purpose of what I'm about to say in terms of the resources that are out there currently. But our map will eventually be able to do these things. But Student Doctor Network is a great resource. Granted, you just kind of are able to see past the people that are on there that are super pretentious and saying they got a 35 on their DAT. I think what you need to look at is what the school's asking, because people will post what the school is asking. That's Student Doctor Network. I would also look on Facebook groups. There's a DAT bootcamp Facebook group with, I think, 15,000 people there's constantly dialogue going on that site. I would see if you could reach out to someone who goes to one of these schools. If someone reached out to me about Stony Brook, I'd happy to hop on the call within 10 minutes and tell them everything about my interview, because I'm already in the school and I'm looking to help someone who's looking to get in as well. So those are some additional things that I would say are good for virtual interviews.
The perfect point, Brendan, sorry to cut you off. The perfect thing Alex said, this is a conversation. Brendan mentioned it too. Your interview is a conversation. All right. If you're rambling on and on about, why you want to be in dentistry, honestly, that might not be the best interview. You might not be doing so well. But if they want to know someone that's personable, dentistry is a very interpersonal profession. You're constantly talking to patients, and the relationship you develop with patients and with your colleagues is huge. They want to know they can sit down with you and talk to you one-on-one about anything. I talked about insurance. It went all over. I talked about when I was in a fraternity, it went all over the place. If you're not having a conversation and it is an interview, it might not be going so well. If you're conversing back and forth about anything, you're doing the right thing. Brenda, go ahead.
Kayla, these are some great questions in the chat. I want you to specify the first one a little bit more, but what's something you don't like to hear about your school? Something that Stony Brook, I mean, there were just some things that I mean, personally, I didn't like about Stony Brook, but it was faculty that like would delegate tasks to other faculty who didn't know what to do because it wasn't specific enough. And so it was like certain faculty wouldn't do any work and they get paid a little bit higher. The good news is that those faculty are now moving on, right? So good news for Stony Brook, great news for the students there. And Stony Brook is going to only get better and better from there. Other things I don't like to hear, we were talking about work study before. I never liked the term of, because there's work study where you're like getting students involved and having, but then there's also a point that I noticed at Stony Brook where it's like they weren't hiring any new employees and they were just making more work study jobs so they could pay employees less. But these poor students are supposed to be studying and now you're making them do the work instead of hiring a full-time employee. Like, you got to be kidding me. That's what I didn't like to hear. Kayla, would you be able to specify, you said, what's something you wish you could have done about grad school before starting? Like, do you mean something like about grad school or like something I would have done before grad school, like traveling? If you could just specify that a little bit.
I don't know. I guess like, I don't know, take certain classes or like been more active, like with clubs. I don't know, like just in general, you know?
Sure. Take classes on what you are interested in. That's number one. If you crossed off all your prerequisites by halfway through second year, then, you know, take the DAT and get out of the way. Don't take more classes to try to do better on the DAT. Take classes. You're paying for these. Take classes you're interested in, whether it's art, music, yoga. Do it. You know, do something that you want to have fun with. Before dental school, didn't you like travel in Switzerland or something? This is what I wish I did.
Yeah, this summer was great. I mean, I knew that this was one of the last free summers I'm going to have. So I did a crazy trip to Iceland, England, and Greece. So definitely enjoy that last summer for sure. And Brendan's right. Take the classes that not every class has to be to stimulate your brain entirely. Like I took this great honeybee class where I was beekeeping. I took like a boxing class. I took these great healthcare classes. Cornell had a lot of those options available to me, but it doesn't all have to be, crazy rigor. It doesn't have to be, preparing for maybe this class will get me a point higher on the biology section. Like, you're going to relearn everything when you do DAT bootcamp or Destroyer. Like, you learn how to take the test. Like I said, just take the prerequisites and then just worry about enjoying your time when you're there. And then something that I kind of regret in undergrad is in the earlier years, I would say no to a lot of things that came up. I would think I need to study. And then in reality, an extra taking out 2 or 3 hours, it wasn't going to make any difference on my exam grade. Here, and of course, there are times when you need to buckle down and study, but in the grand scheme of things, like, you got to choose your battles. And if there's something that you think you could take off time, like, do the fun thing. That's something I would say.
Just going back to Kayla's original question about the school, you have to remember that dental schools are a business. That is first and foremost. Yes, it's a dental school. There are patients there. They are caring for patients. It is an educational facility where we learn. At the end of the day, it is a business, and they are trying to make money. So you have to consider that with schools. And when you talk about a state school, whether it be Stony Brook, University of Florida, California, wherever it is, there is the political aspect of that there is the bureaucracy and the red tape that goes into it. So all of those are things to consider. This is where the map becomes a huge advantage, or just talking to students at that school and seeing what that school is like, because the website will present it in one way, and it'll say, yeah, we do all, X, Y, and Z, and you're in clinic right away, and you do all these amazing, wonderful things, and it's all beautiful and butterflies, and this is the best school ever. But then when you talk to the students there, things might not always be so rosy, and there might be things that you want to focus on that that school might not offer. That's something I found out in residency. I was talking about with Brendan last week when I met up with him in the city, that these were things that I didn't even think about. That in my residency program, I'm thankful that we're in clinic a lot more often. We're in clinic about 8 hours a day. In other schools, they're in clinic only 3 hours a day. And that's something that I didn't even think about. I thought it's a residency program. Everybody's in clinic all the time. Not the case. A lot of them are in class a lot more. A lot of schools are, do you want to be in med school classes? Do you want that? Is that something you're interested in? Like Brendan said, he was debating med school. Oral surgery is the perfect combination of both. So maybe having med school courses was right for him. If that's not something you're interested in at all, why waste your time with a med school class if it's not going to help you? Why did we choose dentistry? That is a loaded question, and that is something that you have to figure out for yourself. You know, for me, I kind of ran.
Keith.
I like to work with my hands. As they all say, I like to work with my hands. So why didn't you become a carpenter? That's what the fact is. Why don't you become a carpenter then? You work with your hands as a carpenter. So, you know, you'll have to think about this for yourself. For me, I really did think about medicine also. In all aspects of medicine, I really did think about it. I always thought emergency medicine was cool, but I found out very quickly I don't have the stomach or the heart for it. You know, so just doing some investigation into medicine, I found out it wasn't for me, and I just started shadowing dentists. That became, you know, my dad's best friend is a dentist, a very successful one at that. Shadowed him a couple of times. My own orthodontist, I was there as a patient, and then I went there a couple of times. I had an uncle who was a dentist. You know, I went around and I saw what it was like, and the day-to-day was something that I was very interested in. Not only the ability to be your own boss, you know, to start your own business, but also to interact with people, to help people. It's underestimated how much we help people and in what ways we can help people. Don't think that you're just, oh, we just put in a crown or we just did a filling today. For some people, it really does make a big difference when you can take people out of pain almost instantly, and that really does go a long way. For people that have, you know, certain conditions or diseases or, you know, pathology, you can really make a big difference in their life. So those were all things that were very interesting to me, while also being able to explore other areas of business, you know, maintaining a family and being present with my family. I didn't want to have to be on call. I didn't want to have to worry about being in the hospital. So that's why orthodontics also played a good role for me too. So, you know, that was kind of the reasons why. That's why I think investigation into the field was huge. I'm gonna let the other two guys answer, and just keep an eye on the clock. We're going, you know, we've already gone 20 minutes past, but we have questions. We'd love to answer them.
Yeah, the really brief rundown for me is my pediatric dentist had a really profound impact on me. And ever since I was 5 years old, I would always say, like, I want to be a dentist just like you. And he would, every time I would go in there, he would, you know, be really excited to see me. And I mean, it was just taking that extra time with me that really is something that I remembered. And every time he would be like, oh, when I retire, you'll be graduating dental school and I'll sell you my practice. So, you know, that there's, you know, a few things happen along the way, but that's not necessarily what's going to be happening. But it just the fact that he really took an interest in me and really, like, you know, it's just at such a young age, and it really stuck with me. And it was always dentistry for me, like ever since I was 5. Like everyone in my family always knows that I always said I want to be a dentist. So that was just the dream, and here we are.
And now you're blowing balloons.
Yeah, we're trying to integrate it into the practice so that kids are excited to go to the dentist just as much as I was. So that's part of it.
No, that's actually huge, because if you can relate with a youngster, that's the key. For me, it was different. I thought I was going to go med school or PA or something. And then through undergrad, I started shadowing, and I found there were these 3 guys at the gym that were like these buff old dudes, but were like hilarious. They would like, they would make fun of this other guy at the gym. It was so funny. And then they look like these like Guido construction men. And then someone tells me one day, they're like, no, they're dentists. Like, you see that guy, the big guy, he's an oral surgeon. Like, go talk to them if you're studying organic chemistry. So I did. They tutored me through dental school, and like, come in one day, come in this day. Are you free Sunday? Come in and see what we do. Like, I got a couple of cases on you might like, come check this out. So I did. I saw what everyone did, and I loved what the oral surgeon did. This was all right before senior year of college too. So it's never too late. The rest is history. Studied, took the DAT, applied, and then hit all the checkpoints during dental school, as you guys all will as well, and get to where you want to be. Yeah, I got to get up at 5:30. So if we can start to wrap this up, any last couple questions? We can make little tips and anything personal that you're going through, like
rapid fire round, shoot out some questions. Lightning round, is that what they call it? The lightning round.
My Columbia interview at 8 in the morning. Tips, please.
Tomorrow, 8 in the morning, Columbia?
Yep.
Research heavy school, at least from my ortho interview. They were a very research heavy school. Very nice people, research heavy school. That's what I remember from them.
Talk about interest in possible interest in specializing, though don't say anything specific, right? Because Columbia students typically go into specialties. A lot of them do, at least. Talk about someone who's in ASDA, and you know that Columbia is very involved in ASDA and how much they advocate for dentistry as a whole. That's a very big thing. Maybe talk about how you're from the New York City area. You've been to Manhattan and you'd love to live in there. I'm just trying to like go around what I'm sure you'll be fine. Dude, get some sleep too. That's
right now I'm definitely gonna go to sleep. All right, guys. Any last questions from anybody else?
And Isabel, did that help? Kayla, did that help, guys? Did we answer your questions? Is there anything like you didn't really understand that we could explain more in?
No, it was great. Thank you. I was pretty discouraged, like after getting that phone call over the summer from.
Don't be. Please
yeah.
don't.
So
Don't let
really
anyone or anything. Nothing can discourage you from what you want. If you have to take 2 gap years, 5 gap years, it doesn't matter. If you have to get a different major, don't worry about it. Okay, just stay on the course. That's just one person who didn't go further. Remember that. That doesn't mean you can't. All right.
And then when you're a doctor, you can shove it in her face. People denying us. Are you kidding me? Come on. They told me I wouldn't get into dental school. I'm an orthodontist. Suck it.
They told me I wouldn't get into the NBA. They were right.
I have a weird question.
Fire away.
So do they teach you how much you should be getting paid in dental school? How like maybe you shouldn't be? I know sometimes you say you get scammed. Like I have the base idea, but then how do you know when you start going up and asking for more, maybe production wise?
Getting paid. I'm sorry, Ursula, to cut you off. But getting paid as a dentist?
Yes.
No, they do not. No, they do not. They do not teach you they teach you nearly zero about business in dentistry. They're busy teaching you about dentistry and some other nonsense.
So how do you know like when to start like not negotiating, but like in a way, like I know from what I've heard, normally it's 500 per day right out of dental school. But then I know other like after 2 years, 700 and then production.
These are all specific to the area. You know, it's very geographical. It's very community based. It's heavy into that. And like, you know, it also depends on how much patients you're seeing throughout the day, how much you're comfortable with. Some people hit COVID, so they're obviously not going to be capable of doing the amount of work that someone who graduated in 2019 was able to do. Like, there's so many factors. Are you a current dental student thinking about this?
No, I'm an assistant, so I'm always asking questions, but that's really like, I know like I know like the 500, someone who's getting paid 500 right now, right out of dental school. And then I know another one after 2 years, he was getting paid 700 and then slowly moved up to production. But how do you know, like would you just know what you know?
This is actually, it's funny you mentioned there's a class that we're taking now as residents, ethics and principles in dentistry. One of them being the first one, Dr. Grasskemper was teaching this class about how, how you are reimbursed and what are things to look for when you're starting, an LLC, LLP, partnership, sole practitioner, all these things. What are the averages? To Brendan's point, it's very area specific. It's very specialty specific. They change across all areas. All those things are things to consider. Point being that for you to be the most prepared for when that time comes, you're going to need 2 things. First thing, you need to study up on these things as much as you can on your own time. That's why something like a gap year can be very important for you, because you can learn a lot about those things now when you won't have the time to in dental school, because the time in dental school is going to evaporate on you very fast to do other things, because you're going to be studying so much now. Even when you have a little bit of free time, the chances you're going to want to read another book is going to be very slim. You're going to want to see your family, your friends. You're going to want to go out and have some you time, which you should, to decompress. So study those things on your own as best you can, because things like contracts, how to open up your own office, what are things in a contract that you should look for? Disability insurance. none of these are Medicaid. None of these are things that we cover in dental school. Rarely, if at all, are these things talked about. Of course, the doctors are always there to answer your questions about it if you have them, but this is not a course that you really get because they're too busy teaching you how to drill a crown and how not to, poke someone's nerve and give them, paralysis in the jaw. They're really just trying to teach you those things before they even worry about how you are as a professional. So you really have to learn those things on your own. I was gonna say one more thing, and again, not to plug our own stuff again, but these are things that we're trying to get out there because not only is it educational for us, but we think that these are things that should be available to all you guys. Stay tuned to the channels, Students of Dentistry, Elite Dentist, Top Dental Practices. There are videos that go out there that cover these things. What's a DSO? What are those big organizations that are popping up everywhere that are eating up a lot of land and a lot of patients? And they're taking in doctors. Is that a good thing for dentistry? Is that a bad thing for dentistry? Where do you fit into that role? Those are videos that we cover. What are, how, for me, Invisalign versus braces. Is Invisalign going to run over braces? Is Smile Direct Club going to run, braces and orthodontists out of business? These are things that we have to consider that aren't really being covered. So take the time out to learn it on your own for sure and ask those questions when the time comes. Because when you get out there, you're going to be, if you're not prepared, like a, fish out of water.